Hey everyone, this is Dr. Charles. I just wanted to take a couple minutes to help you learn to assess your client's heart rate information. Assessing a client's heart rate information is going to be critical to you setting up a cardio program for them, and also really important for them to achieve the results not only in weight loss but in fitness improvements. The assessment I want to talk to you about is the talk test, which many of you might be familiar with, but we're going to take a slightly different slant on it today. What we're going to do is we're going to have our clients count along with the seconds on the treadmill. So it'll be 1 step, 2 step, 3 step, and so on. And what we're going to do is we're going to look at when they take a breath in that counting process. So let's get started. Hey Paula, thanks for coming in today.
Sure.
What we're going to do today on the treadmill is we're going to do a heart rate assessment for you, and we're going to take that information so we can set up a cardio program for you.
Great.
Okay. Just so you know, the assessment's going to take about 10 minutes. I'm going to increase the speed and the incline throughout that process, and I'm just going to keep monitoring your heart rate during that time, okay?
Okay.
All I really need from you is to, when I ask you to, we're going to count with the seconds on the treadmill, and when I say go, you're going to go 1 step, 2 step, 3 step, and so on, okay, until I tell you to stop. Makes
All right.
sense?
Sounds good.
Great. What we're going to do now is we're going to progress you into your exercise pace.
Good.
Alright, so we just got our client warmed up and transitioned them to the exercise pace. The exercise pace is going to be dictated by the height and fitness level of our clients. For example, someone who's tall might walk at a pace of 4.0, while someone who's short might walk at a pace of 3.0. In addition, someone who's fit might be at 3.8, or someone who's deconditioned might be at 3.3. So you're going to have to use a little bit of your judgment call based on your knowledge of the client. But once we have that exercise pace set, that looks like a natural fast walk for your client, then you can proceed with the assessment and start to increase the incline at a 1 or 2% depending on the fitness level of your client. Alright Paul, things are going great so far. So like we talked about at the beginning, when the timer here reaches 5 minutes, I'm going to have you start repeating 1 step, 2 step, 3 step continuously until you need to take a breath in timing with the seconds of the treadmill. Does that make sense?
Makes sense.
Alright, perfect. So in 5 seconds, when we get to 5 minutes, I'll have you start the process.
1 step, 2 step, 3 step, 4 step, 5 step, 6 step, 7 step.
Okay,
8
perfect,
step.
perfect. Things are going great so far. We got a little bit longer to go, so I'm going to increase the incline just a little bit. As it gets harder and harder for your client, continue to monitor their breathing using the 1 step, 2 step, 3 step method. Once they have to take a breath before 3 step, you know that you have your client's threshold. Alright Paula, we're doing great. The assessment's almost done. We're up to 7% incline right now. And I'm going to have you repeat the 1 step, 2 step, 3 step continuously for me when we get to the 9-minute mark, okay?
Okay. 1 step, 2 step, 3 step, 4
Alright,
step.
perfect. You can go ahead and stop counting. Since you took a breath after the 2 step, that's the information I needed to know for your heart rate information to set up your program, okay? So we're going to go ahead and slow you down, and we're going to get you cooling down from this, okay?
Okay, thanks.
If your client still hasn't hit their threshold at 8%, we're going to need to transition them from a walk to a jog, and then increase in increments of speed instead of incline for the rest of the assessment. Alright Paula, you're doing great. We're at an 8% incline right now, so instead of increasing the incline more, I'm going to have you go into a jog. So if you can just start jogging for me right now. Excellent. Okay Paula, I know this is getting a little difficult for you, but if you could, just put your hands by your side and walk normally for me.
Okay.
Great. Just a little tip during the assessment, make sure your client doesn't hold onto the railings, and that way you get more accurate heart rate information. Alright Paul, the assessment's over and you did great. Now the reason we did that was to get your heart rate information to set up your cardio program, and the main thing we can do now is design a program for you where you're going to burn fats instead of sugars, and we can guarantee that now you're going to lose weight and get in better shape.
Awesome.
Alright, great. Thanks a lot.
Thank you.
Okay, so it really is that simple. Just make sure to practice on other trainers and yourself before you try it on a client. Also remember, you have 10 minutes during the assessment. That's really great time for you to talk to your client, find out what they're doing with their cardio currently, and also to talk to them about heart rate monitor training and the importance of this program that they're about to start. It really is a great tool that's going to make you a great trainer. For any additional information, just reference the website or go to my blog.